Welcome back to AgriTalk. On today's conversation, we are talking about strengthening veterinary services, especially for animal health and services in Kenya. And with me in studio is Dr. Vincent Olo, who is an animal welfare advisor at the Brook East Africa. Dr. As we took, before we took the break, we were talking about how important a vet is to a farmer, and why the farmer need to have a vet every time in the farm, even if the animals are not sick. But I'm struggling to understand why is it we find ourselves, we are not doing farming professionally. We are doing it as a by the way, majority of especially young people. So you can find someone like me, I sit in the office, but I still want to keep a cow in the village. And I'll just call in the, every morning or evening and ask how many liters did it produce today. Is that the right way of really going about?
Thank you, Philip. I think what you've described is basically a telephone farmer, and whereby you're actually giving that your idea of becoming a farmer to somebody else and expect it's done. It's partly also due to the notion that people have about farming, that farming is the easiest thing to do. There's no science behind it. So it's just anybody can, once you finish doing like your career, like you're a journalist, then you think farming is the last thing that you can land in. But I'd like to let the country know that there's a lot of things that also goes into farming. And so farming is not only for the old people, the retirees that will go home with a wheelbarrow and maybe a tractor. No, farming nowadays is for the young people, and a lot of things have gone in, especially even the IT. And so what you describe will not work for you, because there are a lot of things that goes on into that needs you yourself as a farmer. And because for you to be successful, it's not even the vet, but it's you, the farmer, who has the responsibility, because it's you who will know what needs to be done or what is not being done correctly, and then you call in the support of a vet to come and help you. Because again, the notion that a vet, anytime a vet comes into your farm, then you'll have a positive results on treatment is also not there. Because if you call me as a vet, the animal has been sick for 2 weeks, then there's very little that even the topmost vet will do. And so that's how good that the farmer himself is the first person online that comes, especially when it comes to helping these animals.
Okay. Yeah. Do you think if some of this knowledge could have started being passed earlier, especially for some of us when we were in school, do you think would have helped?
Definitely will have, because initially they were even looking from the primary school level, whereby they're actually part of not the main curriculum, but the clubs, like the 4K club, that clubs that was quite almost in any other school, whereby from that tender age, the children were put in through farming activities, also starting to show the passion and the interest, so that farming is not just left to anybody. Not all of us can become farmers, but also the farming, if the passion is cultivated early enough, then these are among the things. And you can even go further, even in the teaching curriculum with the Kenya Curriculum Development guys, whether to see how farming, agriculture related can also be strengthened to be part of the curriculum, so that farming is also part of life as somebody comes from a young age. And then you can decide to actually from school you're going to become a farmer, not farming coming in as the last resort after you've done what you needed to do. Maybe you are tired. Okay. And retired, yeah.
How important is animal welfare, especially from the basis of what Brook East Africa is doing for fighting for the freedoms of the donkey? I also believe the other animals in the farm also deserve to have someone fighting for them, because I think most of the farmers sometimes take them for granted. You find a cow in a boma where the mud is at knee high, and the farmer thinks it is okay.
Yes, animal welfare is also an area that people think that is only a Western culture, taking care of animals. But animal welfare plays an integral part, especially is very important, because with good welfare is also relates to good health. Mm-hmm. And so currently we have aspects of animal welfare that also cuts very close to human welfare. So it's all interlinked into what is one welfare. So basically, you're right here. At the Brook East Africa, what we're doing, we're looking at the welfare of the working donkeys. And because we know these people keep these donkeys for their own livelihoods. And so that's why we advocate that they also need to take good care of them. And it's not only taking good care of them or even the other animals, like even the dairy cows. What you just described, that the dairy cow is in a zero grazing unit, that the dung and the mud is up to the knee high. That alone is a welfare issue, because you don't even know when this animal goes down even to sleep. And if it's to do that, then definitely, remember the teats are just open. So that, and you can imagine that dung. So the microorganisms will just get into the udder and you come up with clinical conditions like mastitis. So animal welfare also quite ties well to health. But again, with good animal welfare practices, when you practice the 5 freedoms, about just feed your animals well, giving them water, giving them rest, let them express their natural behavior. That also increases the productivity of the animals. So animal welfare ties very well with productivity, which at the end of it means more money for in the farmer's pocket. So we cannot look down on animal welfare, and there are lots of things that happens, and even the general population thinks that there are people who are supposed to do animal welfare. Like even other animals, you see even the way you see chicken being transported upside down, some of them with the motorbikes on top of open vehicles. Yeah, so that is not very good even for the product, even if they're being taken to the slaughterhouse. Still, because the specialists of meat will tell you that that quality of meat, the animal that has not been taken good welfare, then even the quality of meat is not what should be. So welfare cuts across health. Welfare will cut across even the quality of the final product that you have at the shelves. And that's why in some countries they have a very good traceability system, whereby when you go to the supermarket, even if you're buying beef, they can be able to tell you how that animal was raised from day one until when it was slaughtered for that meat. So those aspects of traceability. And so that is an area that as a country we're still working on. Of course, there are also laws that govern aspects of animal welfare. We have the CAP 360, that is a cap against cruelty to animals that the government implements. So there are penalties there, there are fines there, there are jail terms there. Animal welfare ties very well to the productivity of the animals. And so basically what we are saying is how well the animal is taken into the farm, how well good it is taken. And so currently if you take an animal's good welfare, that is, you feed it well, you give it water, it's sleeping in a good place, you are also giving it time to rest if it's a working animal, or even like the dairy cows, if the dairy unit is also well done so that they have space to sleep. Because some of those animals, like the zero-grazed animals, you find then the mud literally knee-high. And of course, that surrounding alone is quite dirty, and so will predispose these animals even to clinical conditions like mastitis. And so good animal welfare practice also leads to good human welfare. And this goes all straight, even if you just look around the way animals are transported. Be it chicken, some of them are motorbikes, on top of open vehicles, be it cows, they're crowded in those lorries and all that. Even if they're destined for slaughterhouse, there's research that shows that if they're transported not in a good manner, and definitely there's a lot of science that goes in behind, and even that will affect the quality of the final product, even if it's meat. So welfare goes all along to even the final product that is produced that you and I will consume. And so looking into that, in Kenya and in Africa, animal welfare has been taken as a Western idea. But basically it's not a Western idea, because animal welfare is closely tied and has a direct correlation with the productivity of the animals, which straight away turns into how much income the farmer has in their pocket. So that's how animal welfare goes across. And even for the donkeys, where we work with at the Brook East Africa. That's because basically, if you take good care of your donkey, then it works for you well. Of course, you prolong its life, and at the end of it, you'll gain more as a person on your livelihoods. So welfare has a direct relationships to livelihood and to actually income and human welfare. But I was saying that there are also aspects of laws, the country laws that looks into the welfare. Like there's a law, Cap 360, that is basically looking onto cruelty against animals. But the only thing is that these laws, some of them were done during colonial times, and they need to be revised so that, an example like fines that are there, you could find fines of 20 shillings, basically. In the 60s, it was a lot of money. Now, if those fines are still there, basically that law is not punitive enough to make sure that the welfare standards of animals is being looked into.
Okay.
Yes.
You've talked about the donkey, and I remember, I think in 2017, 2018, there was a lot of cry when we had the slaughterhouses, and Brook in South Africa was one of those that were leading these campaigns for the ban of the slaughterhouses. How is the situation now?
Actually, let me take you a little back to the history. Yes, through 2017, 2018. So the donkey slaughter, the donkey hide trade has been a big thing for the communities because 2019 census put the number of donkeys at 1.8 million in Kenya. And so from 2016, 2017, and especially after the government licensed the donkey slaughterhouses, the export ones. And so a lot of it went in, but one thing about the donkey is that the donkey was not bred for that for that rate of consumption, whereby a study that was commissioned by the Kenya Agricultural Research Institute, CALRO, found out that the 4 donkey slaughterhouses that the government had actually licensed were slaughtering up to over 1,000 donkeys per day. And those, because the Chinese and the slaughterhouses, they were more interested in the hide, in the skin, and unlike the flesh, the meat. And this also fueled the bush slaughter, the stealing other people's donkeys, and even in the news you must have seen people wake up in the morning and your donkey has been stolen and only the skin has been harvested. So from the CALRO report that did that, and so it was found that, especially coming to the last census that we had, 2019, that now put the number of donkeys at about 1.1. So basically we had lost about 700,000 donkeys, mainly due to slaughter. One of the things is that that rate of slaughter, what CALRO found out was that we were slaughtering at a rate of 5.01%. Mm-hmm. And yet the reproductivity, the regeneration of donkeys is at 1.04%. So they were actually saying that if at all the government would not have banned it, then it would have taken only less than 3 years for the donkey hide trade to wipe out all the donkeys in the country. And because donkeys are very unique, their reproduction is not that easy. They have a long gestation period. Other animals do, like cows will do 9 months. Donkeys do up to 14, 15 months. So they don't reproduce very fast. Things like twinning is not there. You cannot breed them. Some people have tried breeding them. There are a lot of challenges with breeding donkeys. So that is why the hide trade could not be sustained by the numbers that we have. It's good the government, actually the cabinet secretary banned it last year. Mm-hmm. And 3 of the slaughterhouses, one in Mogotio, Naivasha, and Turkana, and there's another, the 4th one was in Machakos. They've gone to court, and so trying to fight the ban. And so some of those cases are still going on. But as Brook East Africa, we are also still supporting, especially working with communities on aspects of preventing them from being stolen, on protection. And we also have cases whereby we're also buying from others and replacing those ones that have been stolen. And basically the way I said that welfare, when we do good welfare, equine welfare, that will also lead to actually promoting natural reproduction of donkeys. And because the trade, even from that report, showed quite clearly that the trade was not going to be sustainable. And even if you look at the economics, that person working with the donkey, a young man working with the donkey like in Kitengela, the report found they earn up to about 11,000 shillings in a month. Yet, if the same donkey went for the slaughter, it will be bought for about 10,000. So in the long run, that young man is better having the donkey. You'll earn more than being sold off one for the slaughter. So that's where our work now is. But so we're still working with communities to ensure that they protect their donkeys.
Okay. Also, as Brook East Africa, I understand Brook has an internship program. Tell us a little bit about this program, and what is the why do you have this program at this particular time?
Actually, part of the Brook, like we said earlier, part of the work at the Brook East Africa is also looking at the veterinary angle where these animals are not being treated, and generally all the animals. And so at the Brook East Africa, we have there's a mentoring tool that we work it through with the service providers on how to provide quality veterinary services to all animals, not only to donkeys. And so we are now, we had a pilot project whereby the Directorate of Veterinary Services, together with the Kenya Veterinary Board, now has an internship program whereby the vets coming from the colleges also are going an internship. Initially, it's only human medicine graduates that went through an internship program. But now the veterinary students are also going through an internship program. And so the Brook East Africa is really collaborating very well with the Directorate of Veterinary Services and the Kenya Veterinary Board to ensure that these interns coming out are also being mentored through this tool. Because this is a mentoring tool. It's a tool that is an on-job, more or less, kind of training. And so that's why, again, we are not training new vets, but we're only strengthening what these new fresh graduates have received from the college, and especially when they are going through their internship program. So these are how the Brook works with the Kenya Veterinary Board and the Directorate of Veterinary Service.
Okay.
Yes.
We've also seen technology coming up, and technology is evolving very fast. Is there a way Brook East Africa is using technology to also improve animal health?
Yes, very true. And we actually have an app known as Mpunda. And so in this app is basically an app that links the donkey owners, or and generally not only donkey owners, but donkey owners the entry point, but generally all the farmers with the service providers in their localities. So it's a system whereby a farmer, depending on where you are, you'll just find out you need a vet, and then they'll be able to know from your location where you are, and then link you with the nearest veterinarian that is around to address your animal health issues. So that is just one. And also, especially during the pandemic, the corona pandemic that now we've had for over a year, there's what we're calling the telemedicine, whereby now just more or less the same thing happening in human health, but even farmers are able to call the service providers, and even among the vets, among themselves, they're able to consult on phone and still find solutions to some of the problems. So yes, we're also taking in technology part of welfare.
Okay.
Yeah.
When we talk about animal health, if you compare us and our neighbors, where are we as a region?
I think within the East Africa region, I think Kenya, we are still much ahead because we have the structures in relation to animal health and veterinary. We have the Directorate of Veterinary Medicine, and of course, if you look at it, we have from the training institutions, like we have the veterinary school at the University of Nairobi, and also another veterinary school at Egerton University. And then apart from those two veterinary schools, we also have a lot of mid-level colleges that produces the veterinary assistants. So, and then we have a very good regulatory structure of the Kenya Veterinary Board. So in the region, I think Kenya still takes lead even in this, and that's where you also find our vets working beyond the borders of this country towards South Africa. And Tanzania comes close, in Uganda, but you see also in the region some countries, instability in some countries like South Sudan, Somaliland. So we might not even compare ourselves with them, but like if you go to South Sudan, you'll find lots of Kenyan vets working there with a lot of international NGOs in those countries. So we are still much far ahead compared to our neighboring countries. And that's why we export the vets out of Kenya.
Okay. There's something you had mentioned earlier about the antimicrobial resistance. How bad is this situation in our country, and what are the effects?
The issues of antimicrobial resistance cuts across from veterinary to human health, and because I say the molecules are the same, the antibiotics, if it's penicillin, if it's amoxicillin, it cuts across. So it is so serious because, and I also explained to you how it moves from animals to humans through the products and the byproducts. One of the things is also the aspects of regulations, and also how easily available are these antimicrobials. And especially now coming to the vet angle is very serious because especially in those arid and semi-arid areas, whereby, as I told you earlier, the vets are, we don't have so many vets there. But we have these shops known as the agrovets that sell veterinary and farm inputs. And so farmers are able easily to access, they can easily access these shops and access these antimicrobials. Because basically also there are aspects of control. Because even if you have the shop here, how do these antimicrobials arrive at this shop? So there's a lot of the systems that ensure that my antimicrobials are easily and cheaply available. But of course, there are controls, like even in the veterinary line, we have the Veterinary Medicine Directorate, which is equivalent to the human one for controlling veterinary medicines that comes into the country and their utilization. So those ones there, but there is still a lot of work that needs to be done. Because just like even in human health, you can walk to a chemist and get any drug that should only be under prescription. But because people take the value for money first, so even the person sitting at the counter will not ask you where the prescription, they only want to sell. And if you move in chemist A and they refuse to sell for you, ask for a prescription, you can as well walk into the next one and you'll get it.
Okay.
Yeah, so those are the challenges in the system.
Are there laws that govern this, or that I can sue someone if I realize that they just gave my animal a lot of antibiotics that were not necessary? Because I also understand sometimes, even in human beings, you go to hospital and they think you will give you either the painkillers and you are told, you go home.
Yeah, I think it's the push for business that people just want to sell these products. And that's why even some unscrupulous vets will actually give antibiotics even when not necessary. And so, yes, there are laws that are supposed to do that. But the only thing is that, the way I told you earlier, that most laws regulating veterinary and veterinary issues, they are quite pre-colonial. And so even if they're there, some of the fines, you'll just get away with it. And so that's why now there's a lot of work to try and review those laws so that, like, if you just discover that you're dealing with a vet who is a quack and is just administered antibiotics onto your animals unnecessarily, then you can take action on them. But now, the aspects of the law, but even if you look at the judicial system, like the prosecution, if you depend on even a policeman to prosecute your case, do they know there's a law that exists like that? It will go all the way to the judiciary, the judge. The judge, that might be the first case that the judge is listening to, and they might not even know where to refer to. And that's why also in the work, we're also trying to work even with the law enforcement officers, even the judiciary, we're just sensitizing them on the importance of this. Because one thing is having the law, and implementing it also needs a lot of sensitization from the people that we expect to move it to the next level. So that is also an area that we work with, aspects of advocacy, lobbying, and there's cutting across all the sectors of the population.
Okay.
Yes.
Are there refresher courses for vets?
Actually, yeah, there are refresher courses, and because the Kenya Veterinary Board is the regulator that regulates the veterinary practice in the country. And among the requirements is that every year a vet has to be retained by the board. And before the vet is retained by the board, then just like in human aspect, there's what is known as continuous professional development, CPDs. So every vet, every year, there's a number of trainings that you have to attend, because those trainings, there are points that are put on those trainings. And so like for a vet, you need to get 20 points in the course of the year. So it means you must have also attended those training courses. And of course, there are also a lot of other trainings that vets undergo either by the government or even beyond the borders of the country. So yes, there's after leaving school, that is not the end of learning. There's still a continuous learning, because that is one of a competency. For you to be a good vet, then you have to continuously be learning, especially now with the development of the internet and the technology, and things are changing. Because and even the farmers are not just the old guys who know nothing. Nowadays, even farmers, some of them are the doctors, the engineers, and so they can also challenge you. And so that's why, as a vet, you also have to continuously improve yourself.
Oh, okay.
Yes.
As we wind up, in less than a minute, the upcoming National Donkey Day. Tell us a little bit about what is in a plan for this year.
Yes, every year on May 17th, we celebrate the Donkey Day. That is basically sensitizing the public about the importance of the donkey position in our country, and also celebrating the donkey and giving the donkey the chance. So this year we'll have activities across the 20 counties where we work, whereby we'll be celebrating the donkeys. A week before that, there'll be activities like donkeys will be given clinics, they'll be treated. We also have their hooves will be done, like the pedicure, and the owners will basically be sensitized on good welfare practices. There'll be competitions where the best well-kept donkey will win some prizes. And so these are all things to ensure that donkeys' welfare is being addressed well. Okay. So that is on 17th, it will be happening. And I also call upon especially the media to come out and also cover some of these beautiful stories and put it out for the general population to see and know the importance of donkeys. So you're very much welcome to these activities on the Donkey Day. Yeah.
Thank you very much, Dr. Vincent Olo. For our viewers back at home, we were talking about animal health and animal welfare. And for those who own donkeys, you know the donkeys also have a day, which is upcoming. And you've had the awards to be won if you've been keeping your donkey well. That is it from us today. Until next time, goodbye.